We are looking at the Rom TotalCare Sport. This is actually the Sport 2, the P1900 TotalCare Sport. And the Rom P1900 TotalCare Sport bed is one of the most popular beds sold in the United States. It comes with an air mattress. This bed is an ICU bed, an acute care bed used in hospitals, medical centers, surgery centers, but also used a lot for home care. And basically, we sell a lot of these beds to customers all over the United States and all over the world. And I wanted to just go through and do a real quick run through to give some basic training and information on the bed itself. Now, the bed itself is fairly simplistic when it comes to basic controls. You've got your control board here with your foot in, foot out, and you can elevate the foot, so you've got a lot of different versatility. You've got your Trendelenburg, and then you also have your chair position. And this bed is the only bed that when you sit it into a full chair position, the feet are actually going to touch the ground. I'm going to go ahead and put it into chair. But one thing about the bed, and this is kind of a walkthrough, is that the bed mattress is going to adjust to the shape of the bed as the bed is being conformed into a chair. And if we kind of move back here, you'll see that that's happening right now. Now, you'll notice that the bed's going to have intermittent places where it's going to stop briefly. That's very normal. What's happening is that the mattress is adjusting to the shape of the bed. And as the mattress adjusts to the shape of the bed, there will be momentarily stop. And right now what's happening is it's going into the hydraulic phase, and the motors are shutting off, and it's basically dropping it down. When you're putting it into a chair position, one of the first things you're going to want to do is you're going to want to take this footboard off. It just slides on and off on pegs, so it's very easy to do. You can see it's just a very simple process. But because the feet are going to touch the ground, you're going to want to take that footboard off the bed. Now, you'll see once again the mattress is adjusting to the shape of the bed, and that's why it's important to get a hospital bed with an air mattress system built into the bed frame, because when it's built into the bed frame, when the mattress when the bed, is moving, the mattress is adjusting to the shape of the bed. If you go with this system, which we call a replacement air mattress, what happens is that the mattress is hanging off a bed pump off the foot of the bed, and then the mattress itself does not know when the bed is moving, and it limits and restricts some of the mobility that you'll have with the bed. Now, what we're going to do is we're going to come over here to the control panel and go through a few things on this bed real quick. If you've watched some of my other videos, and I do a lot of videos on this, we're just going to say the bed is empty. When you first get this bed, the very first thing you're going to want to do is you're going to want to weigh the patient. The reason you want to weigh the patient is you're going to go to scale is because when you weigh the patient, it's going to adjust the firmness of the mattress. So weighing the patient when you first get the bed is important, because that's going to determine how much air is going into the mattress system. And many times, if that doesn't get done, the mattress will either be too firm or too soft, and that's really mainly because the person hasn't been weighed. So we're going to go ahead and do that. In fact, what we're going to do also is come back over here. The bed has lockouts. You can press this lockout button down and then press up, and you can restrict the movement of the person by basically using lockouts. We're not going to do any lockouts now, but in order to get the bed from the chair position to go it flat back, we're just going to go ahead and press this, and this is going to flatten the bed back out. And we're going to want to do that because when we're going through doing the therapy for the bed, which is what we call lateral rotation and also percussion vibration, we're going to want the bed to be a little bit more flat and not into a chair position. So we're going to flatten it out a little bit, and then we're going to come back here and we're going to go through some of the menu items. Now, we've got the main menu, and if you can see here, you've got just the basic functionality. We've got the bed exit alarms, which you've got different angles. You can do sort of pulmonary settings, and then you've also got just getting in and out of bed, but we're not really going to go into those today. I did a brief video the other day on some of the basic features here. You've got the turn assist left, turn assist right, and then you have the maximum inflate and deflate. And the max inflate and deflate many times is going to be used to use a transfer board to help get the person in and out of bed. Now, it's sort of a temporary feature. When you hit that, it's going to max inflate. It's going to max inflate it for a certain period of time, and then it's going to go back to its normal setting. Turn assist left, turn assist right, many times that can be used for changing out the bed linens if the patient is still in bed. And then also we're going to go into our therapy section, which I did that briefly before, but I'd like to go back through that one more time. In fact, what I'm going to do is go back to the scale feature and just reiterate once again. When you first get the bed, please make sure you do this first. Go through and go to scale, hit out the button here that says 0 scale, and then go ahead and hit weigh patient. Okay, so once again, when you weigh the person in bed, that's going to determine how much air pressure is going into the mattress system. If you need more air or you need more firmness, then you can adjust that by, extending or adding weight onto the patient, even though they might not actually be that heavy. You can add additional weight on there for the patient weight and then increase the firmness. But once again, before I go into the therapy sections, the scale feature here is important to go to, and this is for the Sport 1 and the Sport 2. Now we're on the Sport 2. You can tell it's a Sport 2 because it's got a touchscreen system, and the Sport 1 has the same features, but it's a push-button system, and I'll do another video on the Sport 1 to walk you through it. The Sport 1, you're going to push up, push down, and then hit enter, and it'll basically navigate to all the same features. It'll just be done a little differently. Once again, rotation. We're going to go ahead and press rotation. As I've said before, and I've done this before, you can determine the degree of the turn that you want the patient to turn. So if we're at 60 right now, if we wanted to turn them to an 80-degree turn, we could go ahead and do that. We've got 80 left, 80 right, and then you also have the ability to determine how long they're going to be on that side. You can adjust the time. Now, the bed is going to turn the person every half an hour. You can do it shorter than that. You can do it, at 15 minutes, whatever is good for the patient. But we're going to have that set up so that that's basically the setting that the person can choose based on their comfort level and what their medical needs are. And then once we get into that section where we're starting to turn left and turn right, then we're going to go ahead, and once you've got it where you want it, you would start the therapy. You can also determine how long you'd like that to go, and then you also do have the we're going to go back here. We also have the percussion vibration feature, which we've also discussed in the previous videos. But real quick, once again, this is going to help knock the congestion out of the upper respiratory system. So you can determine if it's going to be a low, medium, or high setting, how many beats per minute, how long the therapy is going to last. It's going to turn the person and help sort of thump the upper respiratory system to help break up congestion in the lungs. So the Rom TotalCare Sport and Sport 2, these beds are really designed to do a few things. Number one is help turn the patient while they're in bed, also provide percussion vibration, and then they also have low air loss. And low air loss is basically running a layer of air-conditioned air over the top of the mattress pad, and that is done to prevent sweating. And these beds are made for, ideally made for intensive care patients, people that are going to spend an extensive amount of time in bed. And these beds are known to help prevent bed sores, treat bed sores, and skin ulcers. And this is one of the best beds made in the United States. Now, once again, it sits into a full chair position. Once I get done shooting the video, I will take some pictures of a chair position, and you can see that when it's in a chair position, your feet can literally touch the ground. Real easy, one click here, drop-down rail system. Makes it real easy to get in and out of bed. And then also, if you want to bring the rail back up, just grab the handle. It snaps right back into place. So once again, this is the Rom TotalCare Sport 2, the P1900 TotalCare Sport. This is the newest version that we sell in the used refurbished medical bed market. If you're looking for a refurbished hospital bed with an air mattress system, one of the best ones you can get more information off our website, and you can also go online and get pricing and information. We can ship these from Virginia, California, and also just out of Cincinnati, Ohio. Once again, the Rom TotalCare Sport 2 Air Mattress Hospital Bed.